Welcome back to my channel where we talk about everything related to anxiety and our mental well-being. In today's video, we're looking into the connection between anxiety and chest pain and chest tightness. So chest pain occurs in about 50% of anxiety and panic attacks, and this results in many people visiting their GP or their hospital as they feel their symptoms are far more serious. The advice that follows is for people who have ruled out a medical reason and whose chest pain is known to be associated with anxiety. So, what does chest pain from anxiety actually feel like? When you feel that rush of anxiety, have you ever noticed your heart rate and breathing get quicker and your chest feels tighter? This is often due to hyperventilation, which causes the muscles in the chest wall to go tense and go into a spasm. This may lead you into feeling that you're going to have a panic attack. You always feel that the worst is going to happen. Chest pain due to anxiety or panic attacks can usually feel like a sharp stabbing sensation that starts quite suddenly, even if you're not doing anything, if you're inactive. Other symptoms may include a change in body temperature, shortness of breath, numbness, sweating, dizziness, that feeling of butterflies in your tummy. It's a common experience with anxiety, so it's essential to understand why it happens. And it all comes down to our fight and flight response. So anxiety triggers our body's fight and flight. This is a natural evolutionary reaction to fear and danger. But here's the thing, often the threat isn't real. It's our interpretation of what might happen. It's a perceived threat. So your increased heart rate and chest pain is part of this response, even when there's no actual physical danger. For instance, you might worry about tripping and falling in front of a room full of strangers. Just the thought of it alone can make your chest tighten and cause you pain. This feeling might then lead you to avoid social gatherings, which reinforces that they're scary to attend and strengthens the cycle of anxiety. Let's face reality though. If that was to actually happen, you trip or fall as you walk into a room, yes, you would then probably feel embarrassed and feel that everyone in the room was judging you. Even if you did trip once previously, the likelihood of it happening again is not proportionate to the number of times you've walked into a room. Plus, most people are focused on themselves, not you. How many people in the room do you think will remember your fall a couple of days later? They're busy thinking about their own lives. They're not thinking about what you've done, whether you've fallen or not. They're thinking more about themselves. So if you saw a stranger fall, I expect you'd help them and then move on with whatever you were doing for the rest of your day. You wouldn't be wondering about them and thinking and dwelling on them going forward. So you can see that this scenario exists mainly in our own heads with no concrete evidence to prove that we will, for one, fall and two, embarrass ourselves. The mere thought of entering that room is enough to make your chest tighten and intensify your anxiety. Now, as you start to focus on other physical symptoms, all relating to anxiety, like fast, shallow breathing, the sweating, tingly limbs, nausea, even though these are all normal symptoms, your anxiety may spiral out of control as more adrenaline and cortisol, the stress hormones, are being released into your body. So we need to break the anxiety cycle. And to do this, you need to recognise the initial cause of your anxiety and listen to what it's trying to tell you. Anxiety is like a warning signal, it's like a smoke alarm. It keeps you safe when there's real danger. For example, if you were in the path of an oncoming car, your anxiety would warn you to jump back onto the pavement. In this instance, your anxiety has kept you safe and you have every reason to be grateful. You haven't even had to stop and think about getting onto the pavement. Your anxiety has done that for you. It's evolutionary and it's designed to keep us safe. So notice that the symptoms are the same in both scenarios, whether the threat is real or it's not. So the first step is to determine if you're genuinely in danger at that precise moment. If not, you can use some of the strategies to calm yourself down and activate what we call the rest and digest response, which is the opposite to your fight and flight. So to overcome anxiety-induced chest pain, we need to address the anxiety first. Now, before we delve into these strategies, let me introduce myself and reassure you that I am qualified to give you this advice. My name is Jennifer Roblin. I am an anxiety specialist and therapist, and I have helped countless individuals regain control over their lives and overcome their anxiety, and I've been doing this for about 30 years. So one effective technique is deep breathing exercises, as this has a calming effect on the body and mind and can normalise the heart and breathing rate. These exercises help calm your body's stress response and alleviate chest pain. Try focusing on breathing out for slightly longer than you breathe in. I've got lots of videos on breathing techniques and you'll find all the links in the description. Now let's practice 10 pursed lip breaths together. So close your eyes if you like and inhale through your nose for the count of 5. And as you breathe out, I want you to purse your lips as if you were trying to blow out a candle. And aim for the breath out to be slightly longer than the breath in. Should we try that again? So breathe in for 5 and out. And in for 5 and out. And in for 5 and out. And notice how you feel now. Do you feel calmer? Reducing stress through mindfulness meditation and yoga can also positively impact our anxiety and consequently your chest pain or any other symptoms. Getting enough sleep and eating a well-balanced diet may also prevent the reoccurrence of anxiety attack symptoms, such as the chest pain. Additionally, journaling out your thoughts can help you identify patterns and triggers contributing to your anxiety, so you get an opportunity to reflect. I have lots of details in the description detailing how to journal, and I've got a list of journaling questions that you can ask yourself when you're feeling anxious. Spend time in nature whenever you can. It's grounding and can ease your anxiety. Going for a walk or run in nature is even better, as your body releases endorphins when you exercise, and this is one of the happy hormones. Setting and achieving small, realistic goals to overcome your anxiety will also release the pleasure hormone, dopamine, and you will have that sense of achievement, knowing that you can now tackle something that was previously holding you back. So take a look in the description, because there's a worksheet for my, it's called an exposure ladder, and it's got full instructions on it and you can learn how to do this. However, if persistent anxious feelings and excessive worries are affecting your life, it might be an anxiety disorder, and you might need to seek help from a trained anxiety specialist to create a personalised plan and develop coping strategies that are tailored specifically for you and your needs. Taking care of our mental health is vital for our overall well-being, and if it's left unchecked, anxiety can have a significant impact on our relationships, our work, school and our family life. So if you're ready to take the next step, click on the link in the description and book a free no obligation consultancy call. If you found this video helpful, please like, subscribe and hit the notification button to stay updated with our latest content. Your well-being matters, and together we can conquer anxiety. Until next time, bye for now.